All right, recording in progress. Hi, everyone. I'm Jim Theophilus, and welcome you to the July Bridge Coalition meeting. We do not have a meeting in August, so this will be the last one until September, but we have a great agenda for you, and I'm really grateful to those of you who've showed up. I invite you to enter your name, pronouns, and organization you represent in the chat. And someone should go on mute, I think. Johnny, maybe you. I can see that. If you're not on mute, please go on mute. Sounds like a train is coming after me. There we go. Thank you. Um, as I said before, the Bridge Coalition is a partner program to the Bridge Housing Program. And all of that is North Star's mission and commitment to building a culturally and developmentally responsive and relevant behavioral health system to young people, for all young people, and specifically those facing unaccompanied homelessness. With that, I will turn it over to Mayana.
Awesome, thank you. So yeah, as per usual, I'll be giving a brief little spiel just to kind of ground the space, make sure everyone kind of knows the vibes and the expectations and what we're gonna be doing. Yeah, before we introduce our first speaker of the day, I just want to briefly go over like what the bridge is, general goals of this meeting space. Um, so with that being said, the Bridge program focuses on youth and young adults exiting inpatient care, which is defined in this case as the carceral systems, mental or behavioral health care facilities, and rehab facilities. We have this focus because the data is very clear that there is a high disproportionate rate of youth and young adults exiting these systems and then consequently experiencing homelessness due to a general lack of support and resources post-care, but specifically largely accessible housing. So with that context, the bridge more concretely has three purposes. The first purpose being information and resource sharing, like this meeting today. This first purpose really aims to communicate with our community partners like you all to ensure that we're more informed with up-to-date practices and research regarding the varying forms of support for youth and young adults from those systems. We also share updates and bring information we have to you all in an effort to community build. The second purpose is developing what we call the return to community planning, which is what we have named the discharge framework that we use for the bridge housing when youth and adults are ready to return to community after having spent time at the housing. This framework was and is informed by youth and young adults with lived experience of homelessness and these systems to ensure that we're not just a repeat of the frequent systemic discharges into homelessness. We call it the return to community planning because this is more intentional language that better reflects what we really want to do, which again is have youth and young adults return to community rather than homelessness. And then the third purpose being advocacy, of course. That's how we created and obtained the bridge housing as well as these coalition meetings. And we continue to engage with youth and young adults for input on the work that we do. Advocacy is central to everything that we're doing. So with that, I believe I'm passing it over to MJ to introduce our first speaker of the day.
Yeah, we've got a curveball with you today. I'll be
That's what I was
doing,
wondering.
yeah, that's okay. I'll be doing
Okay.
that. And before we even get to that, I want to give a couple of updates. Um, we did a nice presentation, Healthcare Authority, Mayana, Sarah, and I, and the providers from Spokane did a presentation to the Spokane Health District, the Fentanyl Special Task Force. And I've been meeting with a lot of people from King County and the state. And so we're going to kind of be upping our strategy as we get closer to the 2027 legislative session. We are going to do everything we can to protect the funding for the Bridge Coalition and the Bridge Housing. And in fact, as we start to get some data from the two programs, out of King County and Spokane. We are also, as we get some data, we'll be articulating what if there is expansion, what would that expansion look like? Is it another 90-day house? Is it a program for recovery? As when young adults leave the housing, the bridge program, is it more flexible funding? In my call this morning with King County executives, staff from the executive office, we talked about minors, how to support minors, particularly those in the CSEC world. So there's lots of ideas. The truth is that the state is in such challenging financial situation that we probably will have our hands full protecting this funding. And so that's why we are really garnering, both doing more presentations, but also getting some political support as we go in there. So for an example, one of the things I'm trying to do is get the bridge housing, protect and defend the funding, trying to get that on the King County legislative agenda. You won't be surprised to know that just about every city in the state and every county in the state let their legislators know what their priorities are. And then those legislators from that community, that's kind of what their to-do list is in many ways. So we're hoping to get on the Spokane agenda and also the King County. Ironically, and some of you from King County will know this, our new King County executive, his theme is breaking the cycle. And I don't think there's a better example of breaking the cycle than the bridge housing. Because if young people can exit homelessness, go to treatment, and then stay out of homelessness, that's an example of breaking the cycle. And as I've said here before, my vision, my hope is that going into inpatient is an off-ramp from homelessness. That it can go on, it'll be a narrative all across the streets that, oh, you should get it, you should go to treatment. And if you get into treatment, go to this program called the Bridge Housing or Bridge Point. Because I know somebody who did that and then they got an apartment and then they got a job and they're not out here anymore. And when we wrote the report that started all of this in 2018, one of the things I heard from outreach workers was, we're not even referring to inpatient anymore because they send the young people right back here, and it's so demoralizing to the staff and to the other young people. Well, to me, excuse me, I know I'm being recorded, but that is effed up. That is really terrible that outreach workers are put in that position to not refer to treatment because the young people end up back on the streets upon discharge from treatment. So that's what our work's about. I thank you all in advance for that, for what you do every day. And as I check I'm open to any questions or comments. Anybody want to say anything about what you just heard? Questions, comments?
Yeah, quick question, Jim, about King County's involved. I mean, I just went to the SUD conference. Obviously, a lot of us will be at the legislative forum, King County's legislative forum. At where, and I do know what the new executives, you know, uh, breaking the cycle thing is, but how could King County be involved? Obviously, you got their ear a little bit. So, what more can be done within the King County?
Yeah. And I hope to be at that forum, but if I'm not, I hope you carry it. Yeah, and my direct request to Marissa Chavez today, who's second in command, is that to protect the bridge housing be on their legislative agenda. That when they're talking to Representative Macri and the other representatives from King County, they say this is one of our priorities.
Oh, okay. Okay.
Yep. And then if we add something like another 90-day program or flexible funding, we can talk about that. But the first step is protect this program.
Yeah. Yeah. Blanca was there too. And I didn't seize the opportunity at the SUD conference, but I do think we need to, yeah, seize the opportunity when even when we're asked, or even when we try to invite ourselves to be asked actually for these things. So
Yeah.
yeah.
Yeah, I hope you all will. If you happen to run into a legislator or your executive director says, "Oh, I'm meeting with the legislator tomorrow or this afternoon," make it okay to speak up and advocate and say, well, one of the things we're working on with the bridge is to protect and defend the funding of House Bill 1929. which is the bill that we got passed that authorizes the bridge housing and authorizes the funding to support it.
Okay. All right. Thank you.
Thank you, Johnny. Okay, so let's move on and welcome. Now we got a couple guest providers, but our first stop is always to hear from our colleagues, partners, and friends from Friends of Youth and Excelsior Wellness out of Spokane for an update on the Bridge Housing Program. So, Blanca, Noelle, I'm not sure who I turn it over to, but I'm turning it over. Thank you for being here.
Thank you, Jim. That would be me, Blanca.
Great.
Good afternoon, everyone. She, her pronouns, talking about Bridgepoint from Friends of Youth here in the Kirkland area. Yeah, I second to Johnny, the substance use conference was really, really great. I did attend the entire conference, and I was able to connect with a lot of amazing people that are out there doing the work. Met a lot of other community providers, not just in the Seattle area, but outside as well. So we are focusing a lot on the community outreach as we've been reporting and trying to connect with community partners and just in general the community so that they know what Bridgepoint is, what we do, what or
Blanca, you're kind of
Bridgepoint.
cutting in and out there.
Oh, my apologies.
Yes, I don't think it's you, but yeah. Go ahead, please.
Can you hear me now?
Yes.
Okay. Yeah, sorry about that. Yeah, so community outreach, and what we're trying to do is instead of just emails, we do get a lot of emails, a lot of people calling into the phone, but we do try to as soon as possible or whenever possible try to connect in person with the community providers and really trying to establish for during and after Bridgepoint, and youth are more likely to be successful even after Bridgepoint within the 6 month of aftercare follow-up that we do. Um, I want to highlight and give a special shout out to Job Corps. We've been doing a lot of work with them. They're pretty good about reaching out and just learning more about Bridgepoint. They do have their residential education and job training program, and so we do present it to the young adults as one of the options that if they would like to explore, we can connect them with. And so we've been able to connect at least one of our young adults to that resource. And yeah, hopefully I can report an update for the next meeting on how that went. Otherwise, we love seeing our clients getting out there back to the community with, housing, employment, and all the resources and tools that they need, that they will need eventually to continue being successful. And that's it for Friends of Youth. Thank you so much, everybody.
Blanca, can I ask? I think I remember that you guys were almost full for the first time. Have we reached that milestone yet?
We have 5 young adults in one of the houses, and we do have coming intakes this week to the second house.
Great. Great. Yeah, we've been both Excelsior and Friends of Youth, Sarah, myself, we've all been working really hard on trying to get those intakes to come. I will remind folks that it takes a while for a new program to catch its traction, especially when you're dependent on others to refer. And as one legislator told me, well, that's half of it. Is utilization. Are people really using it? The other half is what's happening to the young people that go there. And that's also what we're focused on. So, all right. Thank you, Blanca. Noelle, was there anything you were going to add? Uh-oh, I can't hear you.
You guys hear me now?
Yes.
Okay. No, I was just saying, Blanca covered it beautifully, just really focusing on building those community partnerships, having, intentionality around communication, not just sending an email, but actually calling people and building those relationships has really gone a long way with referrals. Just excited to get, an increase in referrals, get more young adults in place and getting them with some services and just getting them set up for more success down the road. So just really seeing a lot of turnaround on intakes, but also discharges into positive housing, employment opportunities, and it's just been a really fun and exciting month because we have seen a lot of increase in referrals, but also having some of those discharges that have been positive outcomes and getting them into housing opportunities to be set up for a better and brighter future.
That's great. And I have to say, the highlight of my week, and I wake up going, oh, I hope they don't fire me today. The highlight of my week is running the group with Demetrius on Thursdays. The program is really, I think, a special place. So thank you both. Now we'll go to Spokane, Excelsior Wellness. Dylan, Maleka, I'm not sure which one of you want to start, but please.
Hey everybody, I'll go ahead and take lead on this. Once again, thanks Jim for handed it over to me. Dylan Ramirez, program manager with the Bridge program and also with another young adult service here at Excelsior Wellness Center. Yeah, just a really good overview. As Jim was saying, had a really good conversation at the fentanyl roundtable that took place earlier this month. And then also I've been doing a lot of outreach here in Spokane. I was part of a impact meeting through Pioneer Services that held space for a lot of different providers. So I was able to utilize that as well to really talk about the Bridge program and get the word out. Everybody there was really excited, had some really good follow-up conversations after that. So looking forward to meeting with more individuals from different organizations to talk more. Also, Malek and I took a space today at a case conference that was held at the Spokane Valley space that included different case managers, Spokane Valley Police Department, to really send out the message of the Bridge program and what this amazing housing support resource is able to really provide. There's a lot of excitement about that as well, being able to answer a lot of questions. So yeah, just really getting everything out there. As Jim said, it takes a lot of different providers and organizations to come in with the referrals. So I feel like just being out in the community more is really helping with that. So going back to programming here at the moment, really excited to say that we're up to 5 individuals right now, really working towards continuing to provide the support needed, getting everybody their next steps really up and going. The return to community plan is always a great thing to first go over. We just got our new individual here yesterday. So really being able to take space with them to go over kind of the process, everything, and then just having them, focus through the return to community plan, and seeing it, change and adapt, right? Because their wants and needs really kind of might change throughout this 90 days. So it's really great just to be able to see how the process is going here as well. As people might hear over in the Spokane area, we're just getting word that a young adult shelter is unfortunately going to be closing here soon, actually within the next couple weeks. So I think through the case conference and couple other conversations that I've been having just really kind of seeing where we're able to, just spread out the word, working once again, because unfortunately there might be some more SUD inpatients kind of coming in, and IMBH, the behavioral health in inpatient program that's also here as well. So just trying to work together with everybody to see how we're going to be able to support with this big change that is going to be going on. So once again, just a lot of good movement, good conversations that we're able to have, and space to be taken. And honestly, really looking forward to seeing how the rest of this month moving into the remainder of the year is going to be going. So yeah, thank you
Dylan,
for
can you
that.
say is that VOA's young adult shelter or which shelter is closing?
Yeah,
Is
it's
that
through
right?
VOA. Yeah, we just got I saw it come through some social media things, and then when I was taking space at the case conference today, a gentleman that was through VOA was able to confirm that.
Wow.
So they're going to be they're trying to move around about 40 individuals. I think that was the number that he utilized. So yeah, and as we know this work, it might come pretty quickly for whatever reason. I'm not too sure their logistical matters, but yeah, it was a big change. Yeah. Did somebody put in there for um I thought I saw the place for, yeah, Cannon Hall, exactly. Yep.
Mm,
Thank you for that. Yeah, so Cannon Hall, that's what they've been saying. Is going to be opening up in the fall to kind of support with that. But between now and I think the gentleman spoke in maybe early October, they're hoping for. That's supposed to be completed, but again, that's a couple months, a couple weeks is a big change for all these young adults that are going to be impacted by this. So just trying to get out there and see how we can support and continue to get the word out. So,
yeah. All right. Thank you.
yeah, thank you for that.
Maleka, anything you want to add?
No, I don't think so. The young, just quickly, the young person that came in yesterday, um, it seems really excited to be here, and it's a bright young person. So I'm really excited to get to know them better, and uh, review their return to community plan and help them with that. So yeah.
Great. Great. Any questions for either Friends of Youth or Excelsior Wellness providers? Okay. Well, we'll move on now to our first presentation. And I hope I get your last name right, Amanda. Amanda Duger. She's a health specialist out of Spokane with their SMILE program and their SUD prevention. And I start by thanking you so much for joining us and sharing what's going on. So please take it away.
Thank you. I appreciate being here. My name is Amanda Duggar, and I am with the Spokane Regional Health District. I am the Overdose Substance Misuse Prevention Program Coordinator here. Before I start sharing my screen, I want you to get to know my face. So I don't want to put my slides up just yet. And I also want to share a few personal stories with all of you and why I started in prevention 15 years ago. And I started in prevention when my daughter and my children, I have adopted 3 of my nephews, and I have a daughter as well. When they were just in grade school, I got into prevention within their school, within a coalition here in Spokane called the East Valley Community Coalition. It really was a passion of mine for being able to have parents and caregivers understand the risks and that their children have when it comes to substances. So that's why I joined that coalition. But prior to that, I struggled with my own substance misuse. And And in 2005, I had a stroke due to my own substance misuse, and I ended up in the hospital going on a month. Had to learn how to walk, talk, and eat again. But there was a nurse there, and I shared this because this really resonated with me, and I share this quite a bit with so many people. But a nurse was there, and she would tell me every day that she'd come in, she goes, "Hey, Amanda, today is a new day for a new beginning." And that really stuck with me. So when I talk with people that are struggling with substance misuse, with people with mental health struggles, those that are in recovery, I share that with them, that today is a new day for a new beginning. And that really got me involved and to be like, okay, I can do this. And August 15th of this year, my husband and I will be celebrating 21 years of sobriety, and we've been in
Wow.
recovery ever since. And we did it together. You don't see that very often, that couples do it together, but we decided to do that. And we also decided to really get our children into better things, that we can have fun doing things without using substances. 3 years into my sobriety, I unfortunately lost my mother. I found her lifeless in her room. We took her to the hospital, but unfortunately, she passed away from an overdose of opiates and alcohol. That really got me motivated to be like, I really want to get in somewhere to help not only our youth, but help those that are struggling with substance misuse. And so I got into another organization here in Spokane called Greater Spokane Substance Abuse Council. I started working there prior to COVID and then into COVID, but I did a lot of work there, also working with youth, but I also got into doing legislative and policy work. My mentor, Linda Thompson, that worked there, she was the CEO of that organization, and she really got me to understand and how to talk to a legislator about things that you're passionate about. And my first project on that was to get youth voices to come to talk to the legislator about changing the 18 years to 21 years to purchase commercial tobacco. And we were able to get youth there to talk to them, and we actually got that passed. So now you have to be 21 years or older to purchase nicotine products. And so that was one of my first little thing, and then I just dived right into it. So I will start sharing my screen and share my PowerPoint. So when I first got into that, I really wanted to talk more about how we can help our youth, but also help others. These two people that you see in my screen, that is my mother there and my brother. Like I mentioned to you before, I lost my mother to an overdose. My brother Jason there, I come from a long line of people that struggled with substance misuse. My brother was a Marine. He served our country. He did a lot of great things, but with that came mental health challenges and substance use to help with those PTSD episodes that he had. In 2022, I unfortunately, right before Christmas, I lost my sister, one of my oldest sisters, to a fentanyl overdose. 6 months later, I lost my sister-in-law to the same thing. And all that time, I just started working at the health district, working on like, how can we get more information out there? I started the illicit substance work group, which is now called the SMILE team. And I started that because I wanted to get organizations together to talk about how we can come together and work on this crisis that was happening. In 2024, I got an unfortunate call that my brother took his own life due to his own substance misuse and his struggles that he had. So that really put another passion of mine. But then it thought about it that, it's not just people that are struggling with substance misuse. There are people there that are struggling with their mental health, and they go hand in hand. And so as to why the SMILE team came about, we changed the name actually. The original name was Illicit Substance Collaboration Team, and that started in 2022. Today, it's all about, Smile Team and how collaboration is helping make a difference in Spokane County. Our work is rooted in honoring those we've lost, supporting those in recovery, and preventing future overdose deaths through education, awareness, community partnerships. Every project we take on is centered around hope, reducing stigma, and connecting people to resources. The SMILE team, which stands for Substance, Mental Health, Information, Learning, Education Team, like I said, was originally named the Illicit Substance Collaboration Team. As our work expanded, we realized the importance of including that mental health alongside substance use. Our mission is to increase awareness, share reliable information, promote collaboration, connect organizations, and support our community through education and prevention. So to start off, to better understand the needs of the Spokane County, the SMILE team developed a community survey. That goal was to gather insight on the fentanyl awareness on dangers of fentanyl in Spokane County, to identify gaps in education and prevention, and especially among our younger adults, and the use of the results to create positive messaging regarding that and coming up with like a campaign. We partner with stakeholders, schools, organizations, clinics, treatment services, recovery centers, even libraries. We partnered with the Spokane Regional Health District Data Center to help us create the survey and as well as analyze those results. And today I'm going to share just a few of the questions we asked and then some of those results. So on that survey, we went and we shared this out with many community organizations that are either client-based or if they're a community coalition, anyone that was involved around prevention or services regarding fentanyl, illicit substances, and treatment services. So question we asked was, how well do you believe community members are informed about dangers of illicit substances such as drugs and controlled substances? As you see there, majority of them said somewhat informed. The orange is non-SRHD employees, and the blue is SRHD employees. The other question we asked was what prevention and education programs and incentives that the organization currently offer to address illicit substances in the community. And you can see there were school age-based education programs. That's through our community coalitions here in Spokane County, community workshops and seminars, awareness campaigns, outreach, at-risk population, and then policy system change. So we've seen a lot. They did a lot of outreach for our at-risk population. And then a few other questions we asked is, does your organization provide support services or treatment options for individuals struggling with illicit substance use? And some of them said referrals to treatment facilities and harm reduction programs were a few of those, and then counseling and therapy, and they do have some that had assessments. We asked, what have you found to be effective about getting the awareness about fentanyl out? As you can see, there were social media outreach was one, presentation, billboards, and print ads as well. So what we decided to do on all this information, of course, we had more than just these 4 questions. We had quite a few other questions to ask. But what we did was we wanted to find out how we can get information out about normalizing naloxone and naloxone education. So the SMILE team's priorities has been expanding the naloxone education throughout Spokane by partnering with community organization, healthcare providers, public agencies, and we helped educate and train individuals on recognizing overdoses, responding appropriately, and administering naloxone. As every person trained has potential to save a life. And I personally have trained over 500 people on naloxone education here in Spokane County. So the SMILE team also partnered with our SRHD comms department, and we developed a normalizing Narcan campaign. We wanted people to understand everyone should carry naloxone or have naloxone readily available, and encourage our community members to view it like any other emergency safety tool. Just as we all should have a fire extinguisher or a first aid kit available, naloxone should also be readily available, as it can save someone's life during opiate overdose. So what we did was we had a questionnaire, a survey out. We sent it out to community members, college students, people, senior centers. We sent it out to universities. We gave it out to our like Carl Maxey centers, and our Hispanic community. And we reached out and asked them, if you have Narcan readily available, why do you have it? And so these three awesome community members came forward and they shared why they did. And if you can see there, Alex, who was a WSU researcher, mentioned that they carried it because it was affordable and portable. Then we had Roseanne, who was an Asian adult. She mentioned that every life saved with naloxone is a prayer for a better future for that individual, and she shared about why she thought it would be beneficial to have that on hand, because in her eyes, she always said that not everyone that has a substance use issue or it may have an accidental overdose is living on the street. It's in your home as well. Ian, he is an EWU student, mentioned, I carry naloxone because I'm surrounded by college students who may experiment. So we created these one pagers. We have QR codes on there. You can scan that and you'll go right to our health topic page regarding overdose, where you can get naloxone and how to use naloxone. We also created short 1-minute videos of them sharing out why they have Narcan readily available. We had those on social media. We put them out on posters. We shared them with our community members with these flyers, having them up in the libraries, just to have that dose of reality, to have that why we can save lives and how can we save lives. And then we also, along with that, we created a fact sheet. We had some myths and facts on there. We also talked about the Good Samaritan law. I share that out quite a bit. I'll share a quick story on that. My sister that I mentioned that overdosed and passed away from a fentanyl overdose, she was with a few friends of hers, a few acquaintances, and they were worried that they were going to get in trouble, and they left her in her car. And so I always share about there's Good Samaritan laws that protect people, giving emergency medical care, transportation, reliability. And then if anybody has anything on them, any substance on, they're not going to get in trouble. And so I encourage people to talk about that Good Samaritan law. And then, of course, I talk about preventing overdoses by safely storing all their medications. Another thing that our Smile team talked about was our stigma awareness campaign, which reminds us that behind every screen is a human being who may be struggling. Whether someone is facing mental health challenges, substance misuse, or cyberbullying, words matter, and reducing stigma encourages people to seek help, support one another, and create safer and more compassionate communities. The reason why this project came up was here in Spokane County, on Facebook, there's a Facebook group called Spokane News. Spokane News, they give out every sort of news. It doesn't matter what it is. It could be a fire down the road. It can be emergency this way, but a lot of times they listen to the scanners and then they put in, oh, there's an overdose on this corner at this address. And so when you go on there and you read those comments, there have been so really heartbreaking comments that people would put, like, oh, just let them die. Why are they even here? Don't Narcan them. They're doing it. No, you're just going to keep enabling them. It was really hard for me to see and witness that. And then, of course, with my sister, it was really publicized here in Spokane County on the news about her and what happened to her. And so going up on social media and seeing just those comments, it gets to the family too. Families read those. And so as a group, we decided that, maybe it would be good to have some type of stigma one pager to talk about stigma, and about how that can really have that loud voice that can be really detrimental to someone struggling with substance misuse. So if you see there, we try to make it to, it's like, somebody's commenting, and instead of having those cool comments, we put in, the comment thread's getting really cruel. Another person to put, we should report it. No one deserves that. You're right. Every cruel comment or joke at others' expense doesn't help someone into recovery. It pushes people deeper in isolation. You never know what someone's going through. The words hurt. Our community can do better. Less judgment, more understanding, compassion starts with us. And so we really wanted to share that about choosing compassion, help us in that stigma, and then speak up and stand up. And this was also through our Spokane Regional Opiate Task Force, which is still here in Spokane County. It's getting revamped up. Washington Poison Control has taken the lead on that now. And so we still have that here in Spokane County. Another thing which we did through the Washington Poison Control and the Opiate Task Force, the SMILE team connected with them and partnered with them about creating here in Spokane County. There was the talk about kratom, and then especially our 7-OH, and getting that information out, how potent that drug can be. Here in Spokane City and Spokane Valley, they have banned the sale of kratom now, but you can still get it on the outskirts. So we're still sharing that out. And this one pager, talks about the risk of using 7-OH. And here in Spokane County, I've actually done some more. We're doing brochures. We're getting rack cards together about kratom and 7-OH. We've done some social media posts about it as well. And then we're going to have a health topic page on our website as well about this information. The SMILE team also always encouraging people about safely storing their medications to prevent overdose, especially having accessibility for our young ones as well. But not only talking about that, but safely storing all cannabis products, nicotine products, needles, medications. And then also talking to our aging adults too about having their medication safely stored, and making sure that they have their little reminders out to know that they have taken their medications, because we have seen an uptick here in Spokane County with our aging adults 65 years or older going to the emergency room for accidental overdoses. So we do encourage our partners to talk about that and share that information out. So another thing, back in 2024, the SMILE team wanted to do something for International Overdose Awareness Day, which is on August 31st. So that year we created lanterns. We had people come. Here in Spokane County, we had a big event called Pig Out in the Park. It's no longer, but it was. And there was like fun, entertainment there, but we decided to have this displayed out. We had people come. They were able to make a lantern for the loved one who's passed, and we displayed it there at the park for that evening. We had a few others. Prior to that, we got some lanterns created a weekend before. We had like 3 different stations at 3 different locations throughout Spokane, and was offering this opportunity to people so then we can have them displayed up. So for me, with my sleepless nights sometimes of thinking about my loved ones who passed and how I can help our community, I thought about this, that after we had this event that time, I was like, how can we expand this out? What is something we can do as a community to come together to honor our lives lost and to help those? So one thing I thought about was those that are wanting to be, the healing heart. So, and then those that are, most people that I know that are in recovery are those that are struggling with substance misuse, are very creative people. And so last year, we decided to create what we call Healing Hands, Creative Hearts. And we partnered with our local downtown library called Central Library. And we were able to reserve a couple rooms Last year we had quite a few people, and that's this picture here. We had some organizations come in. We had guest speakers. We had a resource fair. We had, offered those that are struggling with substance misuse or in recovery to come and share their art and their crafts, and we had quite a few good turnout that did that. And on a good note on that, I'd like to share is a young lady came to this event, and she was shy at first. She didn't want to come in. We encouraged her. She kind of sat outside the door for the first half. Finally, she ventured in. She had a conversation with my daughter. She had a conversation with me, and she waited to the very end. And she came up to me and was like, I'm really struggling. I really want to get help. I want to get treatment. And I said, well, let me help you do that. Let me find you a way to get that. And we were able to get her into treatment, and she has been in recovery ever since. And this year we plan on doing this event again. As you can see, we're going to have it actually next Saturday, August 8th, from 11 to 2 at the Central Library. This year we're going to have a panel of guests. We have a couple organizations here in Spokane. Gabriel's Challenge, Katara Johnson Jones going to come. We have a gentleman named Brenton. He bear crawled our Bloomsday route in honor and to raise funds for people in recovery. So he's going to be coming. We're going to have a resource fair. It's going to be a lot of fun for those that are coming, and then to enjoy that resource fair. Upcoming projects for our SMILE team. Well, we're not done. We still have a lot of work we want to get done. And we came up with the ideas that we still need more Narcan kiosk out in our community. So we're going to be working on that. Mental health data. We want to collaborate with others about mental health. How can we help in that area? And then have a continued education guide and a resource guide for our community members as well. Partnering with Gabriel Challenge here in Spokane with that as well. So that's pretty much we're looking forward to more projects and more things to do, and to keeping that awareness out. So I really appreciate you guys' time. I want to thank you all for letting me come and share about the SMILE team and about the work that's happening here at the health district. If you guys have any questions, let me know.
Yeah, Amanda, thank you very, very much. And I want to start by not only thanking you for sharing your professional expertise, but your personal story. And I know I can feel it through the screen how passionate and compassionate you are. And I know how hard it is to kind of repeat a story, and yet it comes across. I'm just touched, and I thank you for that. I do have a couple questions, and then we'll open it up to the group. One, can I confirm that we can get copies of those slides?
Yes.
Yeah, Sarah will do that. I noticed you used the term substance misuse.
Mm-hmm.
And being the thoughtful person you obviously are, can you talk about what's behind the intentionality of using that term, please?
So the intention on that is when people use cannabis, and when you say a drug or whatever, like they don't consider cannabis a drug. It is a substance though, and so you can misuse cannabis. So when I talk about it and I say, substance misuse, and I bring into the cannabis, then they kind of like stop in their tracks, like, okay, I get what you're saying. But if you call it a drug, then they're like, no, I'm not addicted to that drug. Cannabis isn't a drug. And then there are other substances, it's not just around illicit substances or opiates or cannabis or nicotine. There's other substances that you can be addicted to. Caffeine is one of them. That's a substance. There's other over-the-counter medication that people, I'll share a quick personal story. My mother was addicted to quite a few things that were over-the-counter. And so it wasn't the fact that she was addicted to an actual, controlled substance. It was an over-the-counter. And it's still a substance.
Got it. Thank you. I have another question, but I'll open it up to the group. Anyone else have any questions they want to ask?
Yeah, I'll just jump in, Amanda. Thank you very much. Really appreciate it. Johnny Ota, work here in Seattle, doing outreach, homeless youth, medication assist therapy team. Yeah, thank you for your intention, your intentionality around all this. I really appreciate it very much. I was going to ask you a question about Kratom, and then you brought it up. And obviously, we just have to do a lot more work. You all were able to, I don't know how y'all did it, but able to create a ban of sorts in Spokane. And we are far from that here, but it's a really serious issue. And I'm sure it's one that you've paid a lot of attention to. So I just want to thank you for that. And as we move forward, Kratom is one thing, 7OH is another, over the counter, causing really people, we had OxyContin and fentanyl, and now we have Kratom that's actually initiating some opioid dependence. So I just appreciate you. I obviously when you started talking, I knew you'd paid attention to it, but I appreciate that. And we will hopefully utilize some of the things that you guys were able to do there to work on it here on the west side. Thank you very much.
Yeah, I got to give credit where credit's due. So Sarah McNew from the West Spokane Partnership Coalition, Mike Thomas, who's a police officer here in Spokane, and Dr. Lutz. All three of those were the ones that did a lot of work, a lot of footwork to go to our city council and talk about banning the sale of kratom. And so one thing that I had really emphasized on though, when that came about, and I did go talk to our mayor and a lot of our council members, was to have something available for those that were already addicted to that 7OH and kratom, because you take it away, then they're going to just find something else to, some other substance. And that was my concern. And so I was like, please have something in place. And so we do. We have Boulder Care here in Spokane, and we also have Ideal Options that do treat kratom addiction. So I'm this close of getting SRHD to do the same thing.
Thank you. Thank you. We're doing the same thing here and treating people, going into withdrawal off of these substances. But thank you very much. I really appreciate your presentation.
Great. For those of you on the east side, Johnny is kind of a legend here in King County for going where he needs to go in order to be present to young people. So I think we have a couple legends here with Amanda and Johnny at the same time. So any other questions for Amanda? Any closing comment, Amanda? Again, we thank you so much for taking the time. You're welcome to stay, or if you have to bounce, we understand that, but we want you to know how much we appreciate you.
Yeah, thank you so much. And yeah, I appreciate you giving me the opportunity. I know I talked to Sarah at the Fentanyl Roundtable, and she was the one that said, hey, you'd be great to come and share. And I'm glad to do that. I just want to say, I always tell people that behind every statistic, there is somebody deeply loved. And that's what brings me here today. So thank you for having me.
Beautiful. Beautiful. Thank you. And we'll transition now to our next speaker, Jess. I messed up Amanda with a name like Theophilus. You can guess how sensitive I am to getting people's names right. So I will let you say your last name, but by way of brief introduction, Jess is with DCYF and is going to share some housing resources and vouchers that are available to young people coming out of the foster care system. Again, I'll start by thanking you in advance for taking the time. I know you kind of moved your schedule around to join us, so thank you, and please take it away.
Thanks so much, Jim. I appreciate your time. I appreciate everyone's time and the airspace today. My name is Jess Mayrer. It's phonetic. And kind of, if you listen to my dad say it, he's really hard on the R part. I don't go so hard on the R, but I go by she or they pronouns. And I'm happy to share with you some information about our foster care housing program through DCYF. And I'm going to pull up just a few slides I put together for us here today. And with that, we serve youth who are between ages.
Jess, I'm sorry to interrupt. We could hear you very well at the beginning, and now it's much less so. I don't know if the volume is not quite as high.
Let me see here. I might have to turn off my AC. Can you hear me now?
That's better, yeah.
Okay, I'll just speak up and get closer.
Oh, thank you.
And so here at DCYF, we actually have two different programs under my purview here. It's the Child Welfare Housing Program, which serves families, and we have the Foster Care Housing Program, which serves youth who are ages 18 to 24 years old. And the eligibility guidelines you see here on the slide here. So to be eligible for our foster care housing program, youth must have been in foster care between their ages of 16 and 18 specifically. And they must now be between the ages of 18 and 24 years old and have left foster care or will leave within 180 days, because the feds consider it double dipping if they're receiving a federal foster care payment and also a federal housing voucher. There are conversations to change that and advocacy at the federal and statewide level to change that because it's an issue where we have youth who are in extended foster care and can't receive a housing voucher. So that's definitely a point of advocacy. And then also in terms of eligibility, the youth must have been homeless or at risk of homelessness at age 16 or older. I will say that the feds just this week actually expanded that definition of homelessness a little bit with a new PIH that came out through HUD. So we're looking at that as well. Some exciting stuff happening at the federal level around loosening up restrictions for this program. And they also renamed the program. It's no longer just the Foster Youth to Independence program. It's now called the Melania Trump Foster Youth to Independence program. So just a little timely anecdote for you there. But again, that's the FYI is the federal name for the program. And then here in Washington, it's called the Foster Care Housing Program. Yeah, I mean, there's a lot to talk about with the name change, which I won't get into today. But appreciate the comments. So that's our eligibility guidelines. I will show you some data here in a little bit too around like race and ethnicity and get into a little bit more detail about who we serve. Yeah, yeah, there it is. That's true. Yes. And I'll share with you some data here in a little bit too. But sharing with you a little bit of how it works. I know we have people who are smart on policy and mechanisms and things here. So giving you a little bit more detail about how it works here. So the way this works is we partner with housing authorities, which are funded by the federal government, and they receive vouchers from the feds, these FYI vouchers in particular, right? And then we work with contracted providers who then go forth and work with the housing authorities to secure a voucher, an FYI voucher for our youth. And so we contract with different providers in all 6 DCYF regions across the state. So this is a statewide program to provide housing supportive services to these youth who receive vouchers. So youth can opt in to receive those services. It's not mandatory per federal requirements. It can't be mandatory, but they can receive these services through our contracted service providers who do things like housing navigation, provide limited financial assistance, logistical support. A biggie is really filling out the housing authority application, which is fairly cumbersome and complicated. So making sure youth have vital documents, birth certificates, social security cards, things like that. And also after a youth is leased up, then we can continue to provide supportive services for up to 36 months after a youth receives a voucher. And so if a youth has a crisis, for example, we can try to come forward and help them out. If they got in trouble with the landlord, we can do some mediation, mitigation type, not the official mediation, but we can help to mitigate challenges. I'll pause there though, because I'm throwing a lot of information at you fairly quickly and just see if anything's coming up for folks. Any questions or thoughts?
I had a question. How long do they get to keep the vouchers for?
For 36 months, typically, but if they participate in additional supportive services through the housing authorities, they can potentially get an additional 24 months. Good question.
And is there a way to have it be like a standing voucher, like to have it secured without like having to exit the program, like after
No, it's not like other housing choice vouchers. Even we have the FUP vouchers or the Family Unification Program vouchers or housing choice vouchers, or typically they don't have an end, but these do have an end.
Yep.
Any other thoughts or wonderings coming up?
Yeah, you mentioned that they can't um receive like federal like are you talking about extended foster care
Yeah.
checks and the voucher at the same time?
Yeah, the SIL payment. Yeah, that's exactly it.
Okay, so how do they opt out of EFC to get the voucher?
They have to depart EFC, say I'm not participating in EFC anymore within 180 days of receiving a voucher.
Okay, thank you.
Jess, correct me if I'm wrong since we're here, but I know one of the issues that advocates are trying to figure out, and I'm sure you support it, is how can a young person kind of have safe housing till 24, 25? And so the risk of using the FYI voucher too soon is they could time out of that before they hit 25.
Yeah.
Just love to hear any thoughts you have about that.
Yeah, there are a lot of thoughts, I mean, FYI is not an end all be all either, right? There are youth with higher needs, higher acuity youth who need more supports, and the FYI voucher is not an appropriate answer for them. And we don't necessarily want a youth who's 18 years old getting a voucher, especially a youth who's had a lot of trauma or whatever, right? And so there are other advocacy efforts at work, as you noted, Jim, Mockingbird Society in particular has lobbied the last 2 legislative sessions to secure a state-supported voucher for EFC youth, and they haven't been successful. They will go back this legislative session to request some additional supports for these youth. I'm not sure exactly what that'll look like, but we do have conversations happening with the housing authorities, with advocates such as Charles Smith and Kim Justice, to try to get at this solution. One idea that's coming up is using place-based FYI vouchers and having more of like a dormitory type solution where you have case management on site. And that could be something that gains traction. That PIH notice that came out today from HUD with regard to FYI talks more about place-based vouchers. And so that has us saying, oh, that could be a good opportunity. So there are conversations happening behind the scenes to support these youth. And at the federal level too, there's talk of trying to get a waiver but I'm not sure exactly where we're at with that.
Great. Only because you said it twice, the acronym PIH, can you make sure the group understands that?
Public information something, I don't even know what it
Oh,
stands
okay.
for myself, but it's a notice from HUD. They put out these
Thank
formal
you.
notices saying, hey, we're making a change to the program. And that came out just this week, and it was significant. Like I had a bunch of emails this morning saying, hey, you see this thing, so more news to come around that.
Thank you.
Yeah. And then just a little bit more about the supportive services we offer. And this is all, stated by HUD that we're supposed to do these 5 things. And we, is the Public Child Welfare Agency, is committed within an MOU to provide these services for a period of 36 months for those youth who opt in. So we're either to provide the services or facilitate the receipt, right? So not all states actually pay for this. Washington is kind of interesting in that, and progressive, I would say, in that it actually has general fund money going to this type of stuff, where oftentimes many states do not. Most of the time, states do not. So we do this stuff, providing assurances to owners of rental property to assist youth to make sure they can get into a unit. Not all land owners, property owners want to rent to our clients. Educational and career advancement counseling, job prep and attainment counseling, basic life skills stuff. And it runs alongside our independent living services program as well. So for some, they think it's a little duplicative. Others do not. I do not. But so just noting that that's alongside independent living, which we also offer through DCYF. And so this is a lot of words on a screen, but just noting that we have an automated referral form now where youth can actually fill it out themselves. They can self-refer to the program just by using this QR code even. And if it's a self-referral, we don't need a release of information. But if it is a third-party referral, so for example, if one of you want to make a referral for a youth, you would click on this referral form here. You can reach out to me for a referral form link. And then we need to have our consent form. And the only reason I'm really getting into the weeds with the consent form with you here today is because it's so important, because it's so frustrating. We get referrals all the time, but we don't have a consent form. So it just languishes, and then we don't find the client, and then we don't give them services. So that's why I highlighted that. But I'm not going to read all these words, but just maybe give you a minute to digest it, and I'll pause for a second to see if anything's coming up for you. And so I have a team of 3 regional housing liaisons, which certify the referrals as they come in. So the way it typically works, just to give you an idea of the way it looks on the ground, typically is we'll receive a referral from a youth. It comes in through our newly automated referral system. We were using all these old glitchy PDFs until this past year. Now we have this new slick system that feeds one list. It's a really organized thing. So the referral will come in either from the youth or a third party. And then one of our team reviews it for eligibility based on those eligibility criteria I shared with you at the beginning, and then certifies it if they're eligible, if the youth is eligible, and then we'll send it off to the supportive services provider. So in Region 4, King County, that's the YMCA. And so we send the referral to the YMCA, and then they work with either the Seattle Housing Authority or the King County Housing Authority to secure a voucher for that youth, and then do all of those supportive services I shared with you on the last slide as well. So that's what it looks like on the ground.
So, Jess, in order to be eligible for either of these programs, you have to be in foster care.
You have to have been in foster care, yes.
Okay. So that explains. So I would assume and hope that if a young person is in foster care and beginning to age out,
yes,
that at their 17.5, and we always want that to really be 16,
yes,
15.5 earlier.
Yes.
But I assume the social worker is talking with young people about here are your options as you look at aging out.
One would hope, yes.
There's been some tension about how frequently that happens and all of that stuff.
Yeah, and I was just in a meeting with our providers and the same wondering came up, like how much are we educating caseworkers about, sharing with youth that they're, 15.5, 16.5, all of the options, right, including this one. And we're not doing the best job of that yet. We have work to do. And I will say my program is fully staffed as of May 1st for the first time ever. And so we have a lot of exciting work ahead of us. We have a flyer, so we're working to educate folks and do engagement.
Thank you. I will just hold my comments around. This is not a new issue, trying to making sure young people understand what their options are and getting caseworkers, social workers to be proactive with that.
It's not. No, and I hear about it all the time. I'll tell you, Jim, I joined this team on July 1st of last year and I didn't have any housing experience. And we weren't fully, staffed, right? So it's just been a lot of moving pieces with the state budget and bumping and riffing and all of those fun things happening, right? So, but I'm hopeful that our program, if we can be stable for a while, we can really start getting at some of those more systemic challenges.
Great.
So this is the big picture youth exiting foster care into homelessness. This is from a report put out by the Office of Homeless Youth. And I'm just highlighting this because we're actually doing a better job with foster youth, but we're not doing as good of a job with juvenile rehabilitation or justice involved youth or youth who are aging out of or coming out of behavioral health system. So just noting that these types of programs, I'm not going to say it's this program, but we are doing a better job with foster youth in general. And so that's exciting, and we're serving more and more youth, with our automated system and self-referrals. And, so I think that number will continue to decline for foster youth in particular, but we do have more work in other arenas for sure. And this, what am I looking at here? I want to make sure I'm remembering my data. So this is again from the Office of Homeless Youth report, and it's demographics for all homeless youth. And so this gets at the female, male of who is actually aging out into the system, and it's all homeless exits. It's not just our foster youth. So we see these numbers. 78% are between the ages of 18 and 24, the population that my program serves, and noting that we see fairly representative of some of the numbers in the child welfare system, a higher number of Alaska Natives, and then the overall population who are system involved. Similarly, we have a higher number of Black or African American who are system involved too. And then moving on a little bit. And so this is data from my program around race and ethnicity. And so in fiscal year 24, we served 426 youth. And so this is a comparison, the statewide, just demographic, overall statewide data, population numbers, percentage. And then the purple is the foster care housing program population numbers served. So you can see that we're serving a much higher number of American Indian or Alaska Natives than is in this overall statewide population, which is a much smaller number. Similarly, with Black or African American youth, we're serving a much higher number than is in the overall statewide population. And so that's all to say that we're serving what is representative of the child welfare system, which is disproportionate. So our program is doing a pretty good job with equity, but the child welfare system is not. So that's basically what I'm getting at with this slide. And that's what I have to share with you. Happy to talk through any wonderings that are coming up, any thoughts you may have, any strategies you may want to devise to try to get at some of the system challenges. But happy to just chat with you more.
Yeah. Well, you may know this, and you probably do, but the whole Bridge Coalition and the Bridge Housing came from the same RDA data that you cited in terms of most likely to be homeless if you're coming out of inpatient treatment. Um, um, and so that's what the Bridge Housing is all about, the 90 days Friends of You. Anyway, I don't know how much you know about that in terms of background, but I appreciate you citing that data because we did feel good. When I was on our way home, we wrote a report in 2018, and we did feel good that looks like some things are going better in the foster care system for young people aging out. At least it's on folks' radar screen with EFC and that. But we have that's why we're here today is everybody here is committed to when young people go to inpatient to get treatment, they should have that should be a celebratory, let's gather around this young person, make sure they have a soft landing in housing instead of discharging them to drop-in centers that have no beds.
Absolutely.
And
Absolutely.
that's what was happening.
Yeah, no, I absolutely agree with you. And we have so much more work to do, right? You know, and even for our foster care population, right? Those kids with higher acuity needs, you know, what are we doing with them? And I hear from our child welfare teams all the time that we really need to find some solutions for those kids.
Anyone else have a comment or a question? Isaac, I'm going to call you out because I always love hearing your voice. Isaac's with the Office of Homeless Youth and leads the prevention work. What connections do you see or hear in any of this, or what resonates for you? Only because you're such a good thought partner.
Well, I wish I had like some more unique thoughts right now, but we partner pretty closely with Jess. Like Jess is a part of the tertiary prevention subcommittee, which is a subcommittee of the prevention work group, and I think I see you in a lot of the work group spaces as well, Jess. So like, that's kind of like our connection point. And I know as far as like Jess's program, that like one of the recommendations in the state's strategic plan on youth homelessness prevention was to expand that program, or at least take it from a pilot to an established program, which happened. And now that subcommittee has begun iterating and trying to figure out, okay, what are next steps? How can we improve upon this? And they kind of, just correct me if I'm wrong, but I think we kind of like wrapped up on that in the tertiary prevention subcommittee and kind of have like some ideas for moving forward with the program. So I don't know like if you felt it was helpful, but I think that's kind of like where we've been crossing paths.
Yeah, no, it is helpful. And so working with OHY on those recommendations, as Isaac noted, we do work fairly closely together. And so, we're making some traction there. Getting some traction.
Thank you. Thank you, Isaac, for putting up with me there. Any other thoughts or comments anyone wants to make? Questions? Well, Jess, really appreciate you. And again, as I said to the first speaker, your passion comes across. I know I'm kind of a frenemy with DCYF for many decades now. But the thing that keeps it going really is those people that are willing to be in the system and still work hard every day. And I know that's not a thing done lightly. So
appreciate it. Some of my best
so much.
Acquaintances are frenemies. So DCYF frenemies in particular, right? Some of my favorite people to work with. So.
Okay. Thank you so much.
Thanks, folks. Appreciate your time.
Thank you. Same. Okay, we're close to the end. Any community updates or anything anyone wants to say before we end maybe a little early, under budget? I like to be under budget. Anything from the young people about what you heard today? Anything you want to say? Okay, I'll just remind y'all, changing the world is not a spectator sport, but We'll go with that today. Thank you all very much for being here today. And if there's no closing comment, anyone last call? Anyone want to make a closing comment?
Could say something. I think that this is a really like good kind of conversation to have, especially like, with vouchers and how, there's a lot of different disparities that, that affect, people that are aging out and people that are leaving inpatient and, definitely reaching those people and like what was brought up, the justice involved, youth and stuff like that as they transition to an adulthood, like that is a good focus area as well. And it seems like from what the houses are saying, things are working, things are moving forward, and gears keep on turning, and it's a good, a good machine to work with, and I just think, it's just really great to hear.
I think that's a great place to end. A little bit of hope. Thank you, MJ. Meeting adjourned.
Bye, everyone.